Hi, I'm Becca and welcome back to Mental Health Mondays. This week we're going to continue with anxiety disorders. So the topic this week is panic disorder, and again, I'll be using my Abnormal Psych textbook and this workbook. If you experience anxiety at all, I strongly suggest this. It has a lot of incredible tips in it. So, panic disorder is characterized by sudden episodes of apprehension or intense fear that occurs out of the blue, which is incredibly frustrating for anyone that experiences that. It typically lasts for a few minutes, but it can return in waves for a period up to 2 hours. During panic, someone will experience any of the following symptoms. I've written them on this board today. This way you can screenshot it. So the symptoms include shortness of breath, this feeling of being smothered, a pounding or accelerated heart rate in addition to heart palpitations, dizziness, unsteadiness or faintness, trembling or shakiness, a feeling of choking, sweating, or nausea, feeling of unreality. This one's harder to explain if you haven't experienced it, but it's basically this feeling as if you're not all there, and it's depersonalization. You can experience numbness or tingling in your feet or hands. You can also experience hot or cold flashes, chest pain and discomfort, as well as fears of going crazy or losing control, and also a fear of dying. So typically people with panic disorder do not experience all of these symptoms, but at least 4 of these must be present to be considered a full-blown panic attack. If you experience some of these symptoms but less than 4, then you would fall under the limited symptom attack category. You would be diagnosed with panic disorder if you've had 2 or more panic attacks, and if one of these attacks has been followed by 1 month or more of persistent concern about having another panic attack. So you can kind of see that the cycle can get dangerous, and it's frustrating because you start to worry about a panic attack, which can lead to panic attacks. You worry about your anxiety, which creates more anxiety, and it's definitely a tough cycle to be in. With panic disorder, panic does not occur because you are thinking about approaching or entering a stressful situation necessarily. It occurs more spontaneously and for no apparent reason. There is no obvious trigger for panic attacks. Also, panic attacks vary in frequency, so there may be a period of time where you're having consistent panic attacks, but there also may be a time where you have 1 or 2 panic attacks and then you go months without having another one, or years, or it's all unpredictable. A lot of people who suffer from panic attacks do not immediately think that's what they're experiencing, especially with the whole heart thing. You may think you have more of a serious medical condition. A lot of people do go to the doctor and will have cardiac tests done to make sure they're okay. And if you have panic disorder, then these tests will come out fine. But it is important to go to a doctor and see and make sure that there are no underlying or possible medical causes for these symptoms that I've described. Once you rule out any possible medical causes for what you are feeling, it's important to go to another professional to, again, be able to properly diagnose you. The causes of panic disorder that are known as of now involve a combination of heredity, chemical imbalances, and recent personal stress. Major life changes can also trigger panic attacks. There's also something called nocturnal panic attacks, which about 1/4 of people who have panic attacks experience. This is when you are awakened from sleep due to panic. There are multiple treatments for this disorder in place right now, but I will wait until we get into treatment and therapy to go into what they are. Specifically, right now I more want you to have some sort of understanding of what these disorders are and what different people are experiencing. I know that it's a lot of information, so I'm going to let you know that I personally struggle with panic attacks, and this is how my panic attacks express themselves. I think people have this image in their head of someone kind of like rocking back and forth, crying, and like you being able to visibly see someone having a panic attack, but that is sometimes the case, but it's not always the case. For me, I typically experience nocturnal panic attacks, so I will wake up at like 3 a.m. and just be having like a panic attack. And for me, I feel it in my chest. I have a shortness of breath. It's hard for me to breathe. I typically have like cold sweat, so like my hands will be cold, but like I'll be sweating, and then depending on the severity of it, I'll get a numbness or tingling feeling in my fingers. I just have trouble like speaking, so a lot of the time when I'm going through that at night, I'll like text people through it because there's no way I can like actually talk on the phone with anyone because it's just hard for me to breathe. For me, what always helps me is if I do wake up, or if it's just part of my day that I have a panic attack, I make sure I get up and leave the room I'm in just so I can have a new environment to be in, and walking around kind of helps me out. Like every time I wake up at night, I'll get out of my bed and come into my living room, or I'll like splash water on my face to like make myself wake up and kind of like get out of the panic. But a lot of the time you just kind of have to try to breathe as best as you can and know that it's going to go away and that you aren't dying. It's just a physiological response. I also know I've had panic attacks in class where I've had to get up and leave the class just because I knew that would help me. So I think it's all about finding what helps you the best when you're dealing with a panic attack. It's not easy, and it's definitely not fun to experience. And if you're someone who sees someone going through a panic attack, sit with them. Just be there. Some people want someone to talk to. Some people just need the presence of someone else just for comfort. And so that's what I would say to you is, if you see someone experiencing a panic attack, just sit with them and ask if you can do anything. And sometimes they'll tell you something, sometimes they won't, but just be there for them. So just like I end all these videos, I'll start with something I'm grateful for. And this one's small, but I was just thinking today, because I haven't done much, I'm grateful today specifically that I got to wake up so late and just like kind of relax. The quote for this week is, "Be kind to everyone, including yourself." And I decided this one this week because I put a lot of emphasis on us being kind to each other and practicing compassion and kindness, and I think I forget sometimes that it's just as important to practice those things with yourself, because ultimately you need to make sure that you are okay before you have the ability to help anyone else. Lastly, I just want to leave you and say, continue to practice compassion and kindness in your life with everyone around you and with yourself. And remember, you're not alone. I'll always be here for you. And again, if you have any questions, comments, or concerns, you can email the email in the description, or I'll put it right here probably. I'll respond to anything that you send me, whether it's feedback or if you just need someone to support you. Yeah, and I hope you have a great week, and I'll see you next Monday.